Dr. Dipankar Das, a brilliant innovator, academician, who will be presenting laser detection, a novel approach to detect microorganisms. The discussant will be Dr. Subhra Goswami.
Good morning, respected chairpersons and judges, ladies and gentlemen. I'll be presenting my innovation on laser detection and novel approach to detect microorganisms. I do not have any financial disclosure to present here. This is purely an academic one. Well, what we knew from earlier was, let us see the mycotic corneal ulcer. Now, this ulcer was scrapped and in vivo fluorescent stain was done, and it was published because a fluorescent stain that we use in the IV was used to stain the thing, and this innovative publication we have published. Secondly, this is a evisceration specimen, and again a fluorescent in vivo stain was done, and this again this was published. This we knew earlier. Now, can we visualize microorganism without a stain? I'm speaking of a virtual staining. Now, this is the properties of light innovation of microbes and parasites, the cost-effective way I like to present here. Now, there are various uses of laser in ophthalmology, and currently microbiological staining in laboratory has been used since time. And we analyze the effect of laser in different microbes and parasites for their detection. Now, laser from the Pointer class 3 laser product, company 21 CFR and wavelength of 532 was used under the objective of compound microscope. Necessary eye protective measures were taken. Raw specimen and parasites were studied. They were examined in the monitor of a computer attached to the microscope. And the septate fungus, 8 cases were studied, and bacterial colonies were studied for 2, and parasites in 5 cases. All of them were confirmed with the conventional staining. This is the staining that we have seen in the corneal, and this is the fluorescent stain that here, and this is a clean laser when you use them. And you can see this is our innovative fluorescent staining, and this is a laser how the phthalates were screened there. So the inference of this innovation is that stainless laser, that is a virtual staining, and its modification could be helpful in future cost-effective diagnosis of microorganisms, including parasites in real-time live patients. So process of innovation are after a lot of basic experimental stage and scientific imagination. I like to thank cornea department, our ocular pathology department, microbiology department at C. Shankardev Nethralaya. Thank you for patient hearing.
Thank you, Dr. Dipankar. Dr. Shubhra.
Yeah, Dipankar, thank you very much. It's a really innovative trial. Have you had the long-term study of this efficacy, particularly the economical factor?
Yeah, thing is that the properties of light here, simple laser which is used class 3 laser. Now there can be modification. Suppose you use in the slit lamp, we know there are various filters, for example, gray filter, green filter, etc., which we can do in vivo staining. And so properties of light can be used in the future slit lamp to detect those fungus directly. So no, we may have a evidence before scraping is done that fungus is there, the various parasites are there in vivo staging. Because if we increase the magnification of the slit lamp to, in comparison to the compound microscope, it will give a good corroborative evidence about it.
Do you have any other study about the reliability of the conventional method and this method?
No, this is, we have studied in the compound microscope. So this innovation has to be done in the slit lamp and other thing in the future.
Thank you.
Thank you, sir.